Good morning, colleagues. Today's theme is lymphatic system. First question which we should discuss: what is lymph? We can say that lymph is a colorless, watery substance similar to blood plasma that circulates throughout the lymphatic system. Lymph contains cells called lymphocytes. There are several important details in this sentence. Lymph is colorless, watery substance. Because it's colorless, the mankind revealed lymphatic system very old. So it was 3 centuries ago. 3 centuries ago we have revealed lymphatic system, and we don't knew about it before. Why? Because lymph is colorless, and lymphatic vessels they are invisible, and that's why the lymphatic system was revealed occasionally in 17th century. Occasionally, it means that Professor Azelli, which revealed lymphatic vessels first time, he didn't plan to do it. He tried to make an experiment on the living animal, on the dog, and he made section of abdominal cavity, and he have found in mesenterium new unknown vessels which had a yellow color substance, and he didn't understand what is it. He tried to repeat this experiment several times. Sometimes again it have found the same vessels, sometimes no. And later he understood reason. If an animal was eaten before experiment, the vessels was visible. If an animal was fasting, wasn't eaten nothing before experiment, the vessels were absent. Why? Because it was lymphatic vessels which absorbed the fat from the intestine. So if animal use a meal with lipids, with fats, so the lymphatic vessels could be visible. So this is understanding of this part of sentence. Lymph is colorless, watery substance. So it was revealed in specific region of mesenterium, but in other places in the extremities and the walls of the cavities, it is completely waterless, colorless, watery substance. Next, lymph is formed when the interstitial fluid, the fluid which lies in the interstices of the body's tissues, so lymph is formed when the interstitial fluid is collected through lymph capillaries. So formation of the lymph take place inside of the lymphatic capillaries. Very important position. Next, lymph is then transported through larger lymphatic vessels to lymph nodes, where it is cleaned by lymphocytes before emptying into the right or the left venous angle, where it is mixes with the blood. So, most important issue in this sentence is that lymph ultimately should be emptying into the venous blood. So, lymph was formed in the capillaries and ultimately it will be emptying from the large ducts into venous blood, and then is mixed with venous blood. So movements of lymph always is the same direction, from periphery, it means from the interstitial spaces of each tissue, into venous blood of venous angles. It means between the jugular vein and subclavian vein. And last important sentence, lymph transports dead cells, bacteria and toxins to the lymph nodes, where all the bacteria, dead cells and toxins are filtered from the lymph. Then the lymph returns to the bloodstream once filtered. So, one serious feature of lymph movement in our organism is that this movement is necessary for being filtered in a special structures in lymph nodes, being filtered from dead cells, bacteria and toxins. And that's why practically all lymphoid organs, and especially lymph nodes, are located on the border between external environment and internal environment for being filtered, for make our homeostasis constant without damage. What are the functions of lymphatic system? So, first, and maybe one of the most important function, is supplementary to the veins drainage of the tissues. Supplementary to the veins drainage of the tissues. It means that lymphatic system conducts lymph from the tissues into the venous bed. Venous bed means complex of all venous vessels. And what does it mean, supplementary to the vein drainage? Surely we all know that there is such unpleasant disease as varicose disease of veins. Usually women are suffering from this disease, Why? Because one of the factors of its development is the pregnancy and delivery. When the pressure from fetus prevent the normal movements of the venous blood in vena cava inferior. And that's why the small veins on the legs become enlarged, their wall become thinned, and they have deformations as varicose changed. And usually such kind patient with varicose disease have edema of the legs. This edema is due to insufficiency of the venous part of circulatory system. But the same drainage of the tissues fulfill lymphatic system. So lymphatic system can help to the venous system return fluid from interstitium. So they together, lymphatic bed and venous bed, should absorb the fluid from interstitial and transport it to the venous blood. So first function is supplementary to the vein drainage of tissues, means absorption of the free water from intercellular space to prevent edema. Next function, barrier function. It means rendering harmless foreign particles and bacteria. This barrier function, again I'd like to repeat, take place in the border between external environment in which we are existing, all around of us is external environment, between external environment and internal environment, those space which is between cells of our organism. And there is one of the most important physiological law for existing living organism, that this condition of internal space will be always constant. So, for example, if we have the temperature of our body quite high, more than 40 degrees of Celsius, or quite low, less than 34 degrees on Celsius, it will be very dangerous for our organism. We can die due to changement of temperature. It's one of examples of necessity of constancy our internal environment. So this barrier function is for fulfilling the barrier function, fulfilling the constancy of the internal environment. And next, third function is that lymphatic vessels and nodes spread metastatic cells of malignant tumors. They spread metastatic cells of malignant tumors. It's sure pathological function, but very important for understanding that if any malignant tumor develops in our organism, the surgeons should remove not only this tumor, but also the lymph nodes which drain this region. So, so-called lymphodissection is necessary surgical operation together with removal of the malignant tumors. So that's why we need to learn all lymphatic nodes in our organism quite well. Next question. Difference between blood circulatory and lymphatic system. Difference between blood circulatory and lymphatic system. Unlike the circulatory system, the lymphatic system in mammalian, first of all, is open. It means its distal part is closed, but proximal part is emptying to the large venous trunks. So it isn't closed tubes, but tube which is blind. It means closed from distal portion and opened from the proximal portion. And second features is that lymphatic vessels doesn't have a central pump. That's why the lymph circulating in it moves slowly and under slight pressure. You know that arterial blood pressure is more than 100 millimeters of hydrargyrum in norm, but the pressure in lymphatic vessels quite more less. So lymph can move very slowly. The next question, structural composition of lymphatic system. So we can write down such kind of equation. Lymphatic system means or equal to lymphatic bed plus lymphoid organs. Lymphatic bed plus lymphoid organs. Lymphatic bed means complex of all lymphatic vessels and lymph nodes. And what are lymphoid organs? Sometimes they use term instead of lymphoid organs, organs of immune system. Practically, it's synonyms. Lymphoid organs or organs of immune system. So, most important thing in this slide concerns the sense of equation. Two components, lymphatic bed and lymphoid organs, they together forms lymphatic system. Now let's make a list of lymphoid organs. First of all, with red color, I designated central organ of lymphoid tissue, thymus. Thymus is located behind the manubrium sterni. It's not quite large organ. Something similar in the volume to thyroid gland. But it's interesting that in adult we can't see it. We can't find the thymus in adult, but behind the sternum, behind the manubrium sterni, we can find only connective tissue and fat. Why? Because of so-called involution of thymus. Usually after 5 years old, it becomes involved in the process of, we can say, dissolving. It is changed by fat and connective tissue. That's why in adult practically we can't find in our cadaver in third classroom, we can't see it. Next is spleen. We can say that it is most large lymphatic organ of lymphatic system or immune organ, and surely it is organ of peripheral part of lymphatic system, but nevertheless most large. Then tonsils. I use this violet circle for remember you that we have learned 6 tonsils in oropharyngeal region. Let's remember exactly each of it. So one adenoidal tonsil, or another ways we can say that it is tonsilla pharyngea or adenoidalis. And usually the children with hyperplasia of this tonsilla, they breathe in through the mouth, not through the nose, because of this enlarged tonsil prevents the air pass through the nasopharynx. Also, we can find one lingual tonsilla, which is located on the posterior third of the tongue after terminal linea terminalis. They are impaired tonsils, pharyngeal and lingual, and 2 paired tonsils, tubar, tonsilla tubaria tonsils, and palatine tonsils, tonsilla palatina. Tuber tonsils and palatine tonsils. Also, we can find as lymphoid organs a lot of lymph nodes. There are a lot of them. We can say that lymphoid organs altogether have a common volume or weight about 1% of the organism. So if average person has weight 70 kilos, so his lymphoid organs altogether weighs 700 grams. And lymph nodes take 1/2 of it. That means all lymph nodes, they weigh 350 grams. So it is volume of 2 glasses. All small organs, all lymph nodes we can put inside the 2 glasses. It isn't small volume, quite large. Nevertheless, they are very small organs. Then we can say about folliculi lymphatici solitarii. Folliculi lymphatici solitarii. We can say that they are in the mucous membrane of any locations. So, this is an example of wall of intestine, exactly of ileum. And we can find very small, very teeny lymphoid nodules which are located diffusely spread in the mucus. We can distinguish them without any special devices, merely being attentive to the region which we are looking for, which we are investigate by our eye. And these folliculi lymphatici solitarii are located in mucus of gastrointestinal organs, of respiratory system, of urogenital system, of conjunctives, so everywhere in our organism. And beside this folliculi lymphatici solitarii, we also have folliculi lymphatici aggregati, which calls another word as Peyer's patches. Peyer's patches. And they are located only in ileum. And here it is an example of such Peyer's patch, which is an example of gathered small folliculi lymphatici solitarii in single structure, in single complex. So folliculi lymphatici aggregati we can find only in the ileum. And the last position in our list is appendix. Appendix vermiformis. Sometimes they call it as intestinal tonsil. Intestinal tonsil. Appendix has a lot of lymphoid structures inside, and again they are located on the border between external environment. I hope you agree with me that space inside of the intestine always is external environment, and internal environment is a space between cells, so they prevent the open connections between external and internal environment. All these communications should be controlled, and this control belongs to the lymphatic structures, lymphoid organs. So, we have finished this list of lymphoid organs. Next question, structural composition of lymphatic bed. When we are discussing this term, lymphatic bed, we mean complex of all lymphatic vessels and lymph nodes. And this list, we begin from lymphatic capillaries. Lymphatic capillaries. So they are first in this list. Then lymphatic vessels of various diameter. So lymphatic vessels is number 2. Number 3 is lymph nodes. There is one or more orders of lymph nodes location. And there is so-called Mascagni's law, which calls that lymph on the way from the place of formation. So this lymph at least once passes through lymph nodes. So where lymph was formed, we already have said that is formed inside of lymphatic capillaries. And where lymph disappears in venous angles, it means the place between jugular vein and subclavian vein, and being transported from place of formation, from interstitial to the venous blood, lymph always pass through lymphatic nodes, through lymph nodes. Next position in our list, lymphatic collectors. Exactly, we can say that there are truncus lumbalis, truncus bronchomediastinalis, truncus subclavius, truncus jugularis, truncus intestinalis. So, can you count them? 1, 2, 3, 4, 5. What is the difference between lymphatic collectors, number 4 in this list, and lymphatic vessels, number 2 in this list? The main difference is not only diameter, that they are larger, but that lymphatic collectors, they have their own name. So we can say truncus lumbalis, truncus bronchomediastinalis, so on. So truncus means large vessel, and truncus has its own name. And number 5, and the last, main lymphatic ducts. Exactly, ductus thoracicus and ductus lymphaticus dexter. So there are 2 of them, ductus thoracicus and ductus lymphaticus dexter. It's interesting when we read such sentence. First, what about we can think that if there is ductus lymphaticus dexter, so ductus thoracicus should be ductus thoracicus sinister, but it isn't true, because really, ductus thoracicus in the thoracic cavity is located from right side of the spine. So it is located in the posterior mediastinum, right side from the spine. So ductus thoracicus is quite large and it drained the 3 or 4th part of our organism, and ductus lymphaticus dexter is extremely short, not more than 1 centimeter, and it drains only 1/4 part of our organism. Next question. Structural features of lymphatic capillaries. First feature is that they start blindly. What does it mean, blindly? Does it mean that they don't have eyes? No, it means they have closed end. So we can compare lymphatic capillaries with the fingers of the glove. So fingers on the gloves are similar to lymphatic capillaries. If your gloves are new, so on the fingers they have no any holes, they have no any openings, so they are closed peripherally, so they start blindly. This is first most important feature. Second feature could be easy understandable if we look at the scheme. So what is designated on this scheme? We can see red arteriola, which has 3 branches, exactly arterial parts of blood capillaries. So 3 arterial parts of capillaries. Then they have place for gas enchangement and becomes the venous portion of capillaries. Again, it's 3 venous portions we can see here. And these venous portions of capillaries emptying into the venule. So arteriola, blood capillaries, and venules. So this part of blood circulatory system is closed. We don't see any openings. And lymphatic vessel, which is of green color, it originates from these enlarged structures, sac-like structures, which called capillaries. So we can see 1, 2, 3, 4 capillaries, and all capillaries are connected with lymphatic vessel. So here it is lymphatic vessel, and this lymphatic vessels is prolongation of capillaries. The diameter of lymphatic capillaries is quite more than diameter of blood capillaries. They are 20 to 200 microns. Third feature, they do not fall off due to slim filaments. Lymphatic capillaries do not fall off due to sling filaments. Here it is picture where we can find two endothelial cells, this one and this one, and the space inside is lymphatic capillary, and you can see that their walls not contacts with each other, so they are distended. Why they are distended? Due to these filaments, SF, what is it? Sling filaments. These sling filaments represents very teeny fibers which pulls the wall of lymphatic capillaries in different directions, being inserted to the special fascial structures and connective tissue fibers. Due to this feature, lymphatic capillaries always are enlarging it, distending, so they are always opening. And next, lymphatic capillaries, they have wide interendothelial gapes. That's why proteins can penetrate through the wall. So we can demonstrate with this red arrow the direction of gapes through which proteins could be passed. So this is another scheme, and again I use red square for red arrow for demonstrating the direction of movements of each protein molecules. And also we should say that lymphatic capillaries are absent in the cartilage, in the placenta, inside of brain, and inside of spleen. It's interesting that there are a lot of splenic lymph nodes in the hilum of the spleen, but nevertheless inside of spleen there are no any lymphatic capillaries. So these features we should know. I'd like to remember you that all these features are parts of our examiner tickets. Next question is difference between lymphatic vessels and capillaries. Lymphatic vessels, they have valves. This is an example. I demonstrate one vessel, inside of it the endothelial cells, they connect with each other in one direction, in this direction, and they prevent the movement in opposite direction of lymph. So lymph can flow only in one direction, in central direction, but not peripherally. And second feature, that lymphatic vessels, they consist of lymphangiones. Lymphangiones, the structural and functional units of lymphatic bed, that means part of lymphatic vessels between two valves. So in this picture we can see the one lymphangion between two valves, and we can see that movements of lymph is designated by the direction of this black arrow. Next question. Lymphatic flow factors. We can ask ourselves why lymph flow against of gradient of gravity. Why? There are several explanations. There are several factors, and first factor calls in Latin vis a tergo. Vis a tergo. It means force from behind. It means pressure from newly formed lymph. As example, if you see anywhere a spring, a source of water which appears from the growth, from the ground, from the earth. So each moment, new portion of water appears here, and previous portion, it moves in the opposite position, opposite direction. So this movements is due to newly formed portion of water in spring or lymph in lymphatic capillaries press to the previously formed portion of lymph. So it would be good to again ask ourselves where lymph is formed. And answer is inside of lymphatic capillaries. So lymph is formed inside of lymphatic capillaries. Second factor is valves of lymphatic vessels, but this factor not makes the lymph flow, but it prevents flow in back direction. So they helps but not moves the lymph. Third factor is pulsating effect of adjacent arteries. Pulsating effect of adjacent arteries. So contraction of arterial wall helps the lymph to flow inside the lymphatic vessels. Number 4 is passive lymphatic heart, so-called passive lymphatic heart, which is contraction of the diaphragm in the area of cisterna chyli. It's interesting that cisterna chyli, in other words, calls as cisterna peke. Peke was a student in 7th century when he revealed this widening of the ductus thoracicus. So cisterna chyli, this place of widening, is located between crura diaphragmatis. So been passing through the diaphragm, it is contracted together with diaphragm, and this is a real factor of movements of lymph. The next, skeletal muscle contraction, very important function, skeletal muscle contraction. And 6 is breathing movements of the lungs, breathing movements of the lungs. It could be compared with the syringe when we try to suck inside of it the fluid from the ampule. So the same with the breathing movements of the lung. And suction effect of venous blood and the venous angles. Suction effect of venous blood and the venous angles. So, lymph flow factors we have learned. This is an example of elephantiasis, the situation which is due to insufficiency of these factors which we listened in previous slide. On right picture, this edema, lymph edema of lower extremity is due to obstruction of lymphatic vessels by the Gelmins. Inside of this place, Gelmins prevents the lymph flow. That's why the volume of the left extremity is 2 or 3 times more than right extremity. And in left picture we can see the right leg with lymphedema due to impossibility to pass through inguinal lymph nodes because they were removed due to surgical operation. So this example of edema when factors of lymph flow doesn't work. Dear colleagues, we obliged to know this scheme. I recommend you to make a photo from this slide because it would be good to have possibility to draw it by heart and understand the principles of formation main lymphatic ducts. So you can see that ductus thoracicus, this one, ductus thoracicus, is most large lymphatic vessel in our organism. It is appeared from junction of 3 trunks from each side, truncus jugularis dexter et sinister, truncus subclavius dexter et sinister, and truncus bronchomediastinalis dexter et sinister. So we can see here that ductus lymphaticus dexter draining the right half of head, right half of neck, and right half of the thoracic cavity, and completely right hand. All the another structures of our organism are drained into ductus thoracicus. So ductus thoracicus is formed due to connections of two lumbar ducts, truncus lumbalis dexter and sinister, and third vessel is truncus truncus intestinalis. Here it is example of intestine, and TI is truncus intestinalis. When they connect to each other, they have this widening, which is cisterna chyli, and cisterna chyli serves for movements of lymph as a passive lymphatic heart. So you need to be ready to draw this picture by heart. Dear colleagues, we have discussed all the questions. The last question concerns the lymph node and its structure. So I demonstrate to you the picture of lymph node. Please also make a photo and be ready to explain all features of its structure. So this is finish of our lecture. I ask heads of the groups to mark those who was attended. So thank you. You are free, and heads of the group, please make mark in our electronic BRS system journal. Thank you.